Okay, so for the next obstetrics concept we should be looking at is what is known as birth trauma. Birth trauma. So for this birth trauma, it could be either way. It could be problems on the baby, it could be problems on the mother. Do you understand? So birth trauma just refers to physical or psychological injuries sustained by what the parent that is actually giving birth or the baby that is being birthed to. Understand? So it's more common okay than many realize, right? It can have lasting effects on your health, on your relationship, your mental well-being, and all of that. So for the types of birthing traumas that we have things like physical injuries. So on the mother, you can have perineal tears, all right, pelvic floor damage, probably because of how the baby presented. Normally, a baby should present with the head, cephalic presentation, all right. Could be nerve injuries, could be postpartum hemorrhage. Okay, psychological issues. That's when she's having all those anxiety, traumatic syndromes, depression, dissociation. Okay, for newborns, they could be bruised, as they are trying to pass through the birth canal. You can have fractures, can have nerve damage. You can have what injuries on the head, causing accumulation of what blood there. That's cephalohematoma. Neurological issues. That's when you have problems associated with nerves. So causes and risk factors is this. Emergency interventions. So you guys started doing a procedure that you didn't actually properly plan for. So everything is in a rush. Long labor, or the labor is too fast. Okay. Lack of informed consent or poor communication from the medical staff. All right. So previous trauma, feeling powerless or unheard during labor. All right. So emotional impact. It can cause flashbacks. The mother is just thinking about the crazy things that happen in the room, nightmares, and even panic. Avoidance of reminders. So the mother doesn't want to go to the hospital because she's reminded of what happened to her here. She doesn't want to see the baby because she's reminded of what happened. There's difficulties bonding with the baby because maybe the baby has caused a lot of things to you. Guilt, shame, anger, you're feeling broken. So partners may also experience trauma from witnessing the birth. That's the husband, right? Treatment is all those trauma-focused therapies, medications for anxiety, depression, support groups. She shouldn't just be kept in isolation. She should connect with others and all of that, right? Birth debriefs. This one is before you go into the labor room. Over time, they are telling you a lot of what could possibly happen. Do you understand? So it's not new to you. The continuity of care of any injury that was sustained during the birth time.